Okay, hi Andrew, I'm Joanna. We're going to be doing an assessment today and we're going to start out by assessing your cranial nerves. So we're going to test cranial nerve number 1. I'm going to occlude one side of your nose and put a scent under your nose and just have you tell me what that smell is, okay? Go ahead and close your eyes.
Vanilla.
Okay.
Alcohol.
Okay.
Vanilla. Alcohol.
Okay, great job. And then cranial nerve number 2, we tested with the Snellen chart. We got the full history, cranial nerves 3, 4, and 6. We're going to test for, pupils and for extraocular movement. Okay, so I'm going to have you follow this pen light with your eyes. Don't move your head, just with your eyes. We're going to test all quadrants of vision. And then for extraocular movement. And then I'm going to shine this little light into your eyes, check your pupils. Pupils are equal, round, and reactive to light. And then we're going to test cranial nerves 5 and 7. I'm going to have you puff your cheeks out, smile, wrinkle your forehead, frown. Okay, and then for cranial nerve number 7, I have a pair of tweezers. One has a sharper end and one is a dull end. I'm going to touch different spots on your face, and I do need you to tell me where I'm touching and if the sensation is sharp or dull, okay? Go ahead and close your eyes.
Sharp on my cheek. Sharp on my chin. Dull on my forehead. Dull on my cheek.
Okay, great. And then we test cranial nerve number 8, which tests hearing. So I'm going to tell you a word. I'm going to stand about 1 to 2 feet away from you, and then I'm going to have you repeat the word back to me. Morning.
Morning.
Okay, and same thing on this side. Morning.
Morning.
Great job. And then you can also do the bone conduction test with the tuning forks. And then we're going to test cranial nerves 9, 10, and 12. I'm going to have you stick your tongue out, lift it up, down, one side to the other, say ah, and then you can use a tongue depressor to elicit a gag reflex to make sure they have one. And then the final cranial nerve we're going to test is cranial nerve 11. I'm going to have you shrug your shoulders up, move your head toward my hand. Same. Good job. Okay, now I'm going to have you hold your hands up and touch your fingers to your thumb as fast as you can. Okay, now I'm going to have you take your index fingers and alternate touching your nose. Okay, now I'm going to have you stand up, arms out straight. So I'm going to have you close your eyes and stand on one foot. Okay, now switch feet. Okay. Now I'm going to have you walk towards me on your heels. Okay, now turn and go heel toe back. Okay, now walk towards me just on your toes. Okay, great. Okay, you can go ahead and have a seat. And now I'm going to have you take one foot, the heel of one foot, and run it down the shin of your other leg. And same thing on the other side. Great job. Okay, now throughout the assessment, I'm making sure to assess the patient's skin and checking for any abnormalities. So I'm going to have him sit forward. We'll start at the head and assess our way down. So we assess for any abnormalities of the skin on the head, any tender areas of the head, palpate for any masses or anything. And then while we're here, we also want to assess the auricles of the ears, make sure they're symmetrical, there's no lesions or sores. We're going to take our otoscope and look inside the ears, check the ear canal and the tympanic membrane for any signs of redness or swelling, check for signs of excess wax in the ear canal, and check on this side as well. And then we're going to change our speculum, and we're going to check the patient's nares. We're checking for the color of the turbinates, any signs of drainage or secretions in the nose, any congestion. Okay, look at their nose. And now I'm gonna have him open his mouth, say ah. We check the mucous membranes of the mouth and the pharynx, the tonsils, if they do have tonsils still, checking for any redness, swelling, lesions, make sure that the mucous membranes are moist and intact. Next, we move down to the neck, and I'm going to assess the lymph nodes in the neck and also the thyroid, checking for any masses or enlargement. And also palpate the carotid artery separately on each side of the neck. And then use the bell of the stethoscope to auscultate for any carotid bruits on both sides. Okay, appears to be normal. Okay, I'm gonna have you sit forward for me. And we're gonna check chest excursion. I'm gonna put my hands on the patient's back, much like this. Have the patient take a deep breath in and make sure that the chest rise is equal and symmetrical on each side, and we check that on anterior and posterior. Next, we'll check tactile fermentus. So I'll have you say 99.
99. 99.
Again.
99.
Again.
99.
Okay. And any tenderness here over your kidneys?
No.
We're checking for any CVA tenderness. Okay, now we're going to listen to lung sounds and heart sounds and check for any bronchoscopy. Okay, so on lung sounds, I'm going to have you take a big deep breath in. Another. 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 Okay, now listen to the back of the lungs. One more. Okay, now I'm going to have you say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, now I'm going to listen to heart sounds. Go ahead and breathe normally. I'm just going to listen to the aortic, pulmonic, second pulmonic, Bird's point, tricuspid, and the mitral. Okay, heart sounds are normal, lung sounds are audible and clear in all areas. No adventitious lung sounds noted. Okay, and while I'm checking the cardiac system, I'm also going to check for capillary refill and color. And I want to check capillary refill symmetrically, make sure that it's symmetric on both sides of the body. I would also check the toes. And then I'm going to have the patient lay down, and next we're going to assess the abdomen. At this point, I would have the patient either in a gown, remove the shirt, move this so we can see. So I can assess for any abnormalities on the skin, as well as any masses that can be seen on inspection. And first off, I'm going to listen for bowel sounds and also use the bell of the stethoscope to listen for any abdominal aortic bruits. Bowel sounds are active in all quadrants, and I'll listen to the aortic bruit. And that right there. Everything appears to be normal. And now that we've auscultated and inspected, we're going to palpate for the edge of the liver on the right side here, and for the edges of the spleen, and also checking for any masses on the abdomen, such as an aneurysm. We're going to be sure to not palpate too much or excessively around a mass, because we don't want to rupture that or disturb it. Okay, and while the patient's lying down, I have them flex his feet. Go ahead and flex your feet. Flex. Any pain in your calves? Okay, no. Go ahead and push against my feet, my hands. Okay, great. And now put your feet down. Okay. Negative Holman sign there, no signs of clonus. I'm going to have the patient sit at this point. And now I'm going to test, we would test deep tendon reflexes. I don't have a reflex hammer, so I'll just show the position in which I would put the patient to test these reflexes, to test the brachial reflex, put the patient here, and use the flat edge of the hammer and elicit the response by hitting the brachial artery with the flat end of the hammer, and then also the radial artery by tapping it with the blunt end of the hammer. And to elicit the triceps response, I have the arm free hanging like this, and elicit the response with the triceps tendon with the flat edge of the hammer. I would also test those reflexes on the patellar tendon with the legs free hanging, and tap the patellar tendon with the flat edge of the hammer on both sides. Reflexes are done bilaterally, and then have the patient in a position that they can be free hanging, and have their foot dorsiflexed, and then elicit that reflex response from their Achilles tendon on the back of their ankle. And at this point, I can also check for any edema in the legs and feet, capillary flow, and I can also check radial pulses, popliteal pulses, and also dorsal pulses on top of it to make sure that they are all normal.